Hi, I'm Angie. I'm in my final year on the chiropractic course, and I'm here today with Gary, who's going to tell us a little bit more about his role and the OfS project.
Hi, I'm Gary Francis, as Angie said. I'm Head of Practice-Related Learning, and that includes working with course teams on placement, innovation and development. It also includes simulation-based education and working with the technical support team to deliver that.
So Gary, would you be able to give us an update on the OfS grant that we got given?
Yeah, we're currently standing in the hospital ward of the OfS grant. And for those that haven't reviewed episode 1, the Office for Students grant was a capital grant that we applied for and were successfully awarded at 2.1 million. And the sort of premise of the grant was to develop campus, to increase our skills capacity, to create opportunities to develop innovative placements as well. So what we've done is we've basically created a variety of different settings. So we've got an immersive space, we have a ward space, we have some renewed sort of chiropractic technique spaces and teaching spaces on campus, and we've also developed and are developing a space for dental as well.
Oh, how interesting. That'd be cool. So what is simulation?
Yeah.
I know some people know about it and some people don't, but if you could give us a bit more information
Yeah.
about what that is.
It's a technique of training, rehearsing, to try and give people the opportunity to behave in the way they would behave in real life, but in the safety of the teaching and learning environment.
Oh, cool.
So what we've done is we've created these spaces so that we can then mimic sort of as best we can real life to give students an opportunity to be put through their paces with their tutors and with their peers,
Yeah.
so that they can learn. So really sort of a technique that we're going to be using, so this will be sort of directly involve sort of case study work, etc., from a clinical side. But what's really exciting and what's very new for us here is the immersive suite. So this is going to be a completely immersive experience, and we're going to be using it for a variety of different things. So people can use clinical cases in there, they can interact with the walls, move things around. They can also use it for anatomy and physiology. You know, we know very well that anatomy and physiology at the HSU is at the sort of cornerstone of what we do for all of our programs, alongside communication. So simulation is going to play a really good part in going forward.
Yeah. So you mentioned there about like the placement opportunities that will come off the back of this. What would it look like for a student like day to day across the different courses that we've got running here?
Yeah, so what we recognise as courses have developed and sort of clinical provision has changed is that we probably need to broaden our understanding of what a placement actually is.
Yeah.
So yes, it could be an internship in our clinic, it could be sort of various different experiences throughout, but it also could be things that we could do here.
Yeah.
So really end-to-end proper simulation that will mimic a real life scenario that students can sort of, you know, get practice in and also be assessed in order to achieve competencies both from a chiropractic osteopathy in London, but also all of our AHP courses down here in Bournemouth as well.
Oh, amazing. It sounds like it's really going to be beneficial for all the students really in their assessments.
Absolutely. I mean, all students are included this, you know, so for those that aren't very familiar with the OfS, so it's the Office for Students, so it includes everybody. This is not something that's, you know, being resourced through internal funds. This is something that's external. And so we really focused on trying to create the best possible resources for students, all students, irrespective of course.
No, that's perfect. That's really, really interesting. Okay, so we've talked about what it's like day to day. What does it mean for students overall? Like, how can they get involved?
Yeah. So, really good question. So we're about to go into phase 2. So we've got ownership of the sort of estates, and the final things are being developed in terms of the dental provision and all what that looks like. Yeah. But what we're starting to do now is talk about implementation plans, embedding it within course teams. So we'll be having lots of discussions with how this can work within the timetabling and course level structure, but also, and more importantly, I think, is enable. So all of this lovely equipment is no good if no one really knows about it and is trained on it and students feel that they can access it. So a big piece of our work at the moment is really making sure that students really know what it means for them. It could be used for assessments, it could be used for self-directed learning, it could form part of just general teaching and learning. The spaces need to be used, so we need to make sure that simulation is an integral part of the way in which all of our course teams approach teaching and learning for healthcare professionals for the future. We're very much about skills and making sure that students are well rehearsed in their practical skills, but also their communication skills. And these facilities will really, really help that. We've been fortunate enough to be able to add another force sensing table to our estate. So for those of the people that don't know what that is, that's a sort of biomechanics sort of table that allows chiropractic students to sort of measure the force of their adjustments, so they can get a sort of sense of what actual pressure means in terms of sort of what they're actually doing. So it gives another opportunity for more people to use the force sensing table, supporting the work that we've done with people to develop the self-directed learning stuff within the university. We really want to develop that further, and we want to really engage students in how that can work for them.
Yeah, you've mentioned the self-directed learning, and here at HSU, that is a pivotal part of all the learning that we do here, which is really, really cool that we've got this coming.
Yeah, thanks, Angie. It's been great speaking to you.
Angie, no, thank you. It's been great.